Why are your ears ringing? The truth about tinnitus. Have you ever experienced that mysterious ringing in your ears? You know the one, no external sound, but it feels like someone hit a tiny bell inside your ear. Well, you're not alone. Today on Health 360, we're uncovering the mystery behind ear ringing, also known as tinnitus. And trust me, this isn't just a random occurrence. So, let's dive in and understand what's going on with your ears. Tinnitus is the perception of sound when no actual external sound is present. It affects about 10 to 15% of the population, and for some, it can sound like ringing, buzzing, hissing, or even whistling. While the experience of tinnitus is highly individual, it's often more noticeable in quieter environments, like when you're trying to sleep. And that can make it incredibly frustrating. Tinnitus can be split into two categories, subjective and objective. Subjective tinnitus, the more common type, is caused by abnormal activity in the brain's auditory cortex, often linked to ear-related disorders like hearing loss, exposure to loud noises, or even certain medications. Objective tinnitus, on the other hand, is rarer and can actually be heard by others. It's typically caused by abnormalities in blood vessels near the ear. Imagine hearing your own pulse thumping away inside your ear. Yeah, that's real. When should you be worried? Now, not all tinnitus is a cause for panic, but there are some red flags to look out for. If you're experiencing tinnitus in just one ear, or you have accompanying symptoms like dizziness, trouble balancing, or headaches, it's time to see a doctor. These could indicate something more serious, like an inner ear infection, or even a non-cancerous tumor called vestibular schwannoma. So, don't ignore these symptoms. For most people, tinnitus isn't dangerous, but it can be incredibly annoying, especially when you're trying to fall asleep. So, how do you cope? One of the most common solutions is to mask the sound. Playing background noise, using a fan, or even investing in a tinnitus masker can help. Some people find relief by treating the root cause, like hearing loss, or by managing stress, which can make tinnitus worse. So, avoiding caffeine and stimulants might also help reduce the intensity of the ringing. Speaking of stress, it's a big factor in how you experience tinnitus. If you're constantly stressed, the sound might feel louder. That's why mindfulness techniques, like meditation, can be a game changer. Take a moment each day to relax, and you might just find the ringing isn't as overwhelming. And remember, you're not alone. There are specialists and clinics dedicated to helping people manage their tinnitus. If it's becoming too much to handle, reaching out for support is a great step. Tinnitus may be common, but that doesn't mean it has to control your life. Whether it's by masking the sound, addressing underlying issues, or managing your stress, there are ways to take control and reduce its impact on your daily life. So the next time your ears start ringing, don't panic. Now you know what's going on. If you found this video helpful, be sure to like, subscribe, and share it with someone who might be struggling with tinnitus. Stay tuned for more health tips on Health 360. Until next time, stay healthy, stay informed.